We're connecting with community experts. We're connecting with you. This is Connect by 3 News.
Good afternoon, everyone. I'm Monica Robbins, and welcome to 3 News Connect. Our goal is to keep us all connected as we go through this experience together. And Jay Crawford and I, of course, are still coming to you from our home studios. How are you, Jay?
I'm hanging in there, Monica. I hope you're doing okay on this Thursday. Hello again to everyone at home. We certainly know that these are trying times, and we hope you are doing your best to make it through. We're here to keep you up to date on all the latest coronavirus developments, and with that in mind, here is the very latest. And the news is not great in New York City. This is considered to be the virus hotspot, not just here in the U.S., but really in the world right now. New numbers show New York City alone has more than 45,000 cases of the coronavirus. Statewide, New York has 83,000 cases. The travel industry has been making huge changes. Southwest Airlines is going to start offering cargo-only flights to get the much-needed products to those who need it most and keep people off of the planes. And new unemployment numbers just released today. Wow, this is incredible. 6.6 million unemployed claims were filed last week, and that shatters the old record, which was set just the previous week. And Ohio is also seeing record numbers of those filing for unemployment. More than 272,000 claims last week alone. Now let's just dissect those numbers for a second. 272,000 unemployment claims last week in Ohio alone. For the entire year of 2019, the state of Ohio had just 364,000 claims. Unbelievable. Monica?
Well, Jay, it sure is, but we do have a little bit of good news to talk. It's good news for small business owners in Ohio because Governor Mike DeWine has signed an executive order to help those businesses. He's asking landlords and lenders to suspend payments for 90 days to help avoid foreclosures. The order also follows Ohio courts having the ability to suspend evictions through July. And this is important news. New today, University Hospitals has announced they are testing a new drug aimed at protecting caregivers working on the front lines fighting COVID-19. The drug is called ARMS-1, and it may prevent airborne transmission. Now, the study will be conducted by Dr. Robert Salata, chairman of the Department of Medicine at UH. The trial will include clinical staff who are directly caring for COVID patients. UH is working with researchers at Case Western Reserve University, and they hope to begin that trial within the next 2 weeks. And Case has also teamed up with another local hospital system, the Cleveland Clinic, because our local hospitals are working to prepare for the surge of COVID-19 cases. They are now converting the main building on the clinic's health education campus to a surge hospital with 1,000 hospital bed capacity. It will treat COVID-19 patients who do not require high levels of care, and it's close to the clinic's main campus and ICU, so patients can be moved quickly if needed. Jay?
Well, Monica, despite the stay-at-home order, the harsh reality here is that most of us, at some time or another, are going to have to leave our homes, whether that's to go buy groceries or perhaps to pick up medicine that we need. And once we leave our homes, obviously the risk of contracting the coronavirus goes up. But how much does it go up? Believe it or not, Dorsina Drakeford found researchers at Case that say your odds are directly dependent upon where you live. Check it out.
Before you leave your home to make that quick grocery store or pharmacy run, you might have better peace of mind if you knew your risk of exposure to coronavirus.
I know you're very busy, but
2 researchers at Case Western have made that possible.
It's inevitable. We need to go for the grocery shopping. We need to go to see a doctor or go to the pharmacy. But which store I need to go, which will be more risky?
It started as an idea for Fanny Ye, who brought it to her colleague, Ken Leparo, both computer scientists, both wanting to make a difference. They understood daily life would not completely stop with stay-at-home orders, but with more information at your fingertips, you can better protect yourself and your family.
If social distancing is what you're trying to practice, it's easier to practice in areas where there's not a lot of people.
With a program called Alpha Satellite, that's what's measured. It's a map of your coronavirus risk. When you click on the link, you'll see a map of your area or the area you plan to be in. From there, type in where you want to go, and a pop-up will show you the risk index. The higher the number, the greater the risk. Public perception of the virus is also visible, population density, and traffic status.
If you have a lot of people that are unaware and maybe aren't practicing good habits relative to social distancing, and if the areas have high density of traffic, people going into the area, and high population density, maybe that's not a good place to go.
The data is driven by artificial intelligence, automatically compiling the community-level risk in real time, so you can compare different places and potentially lessen your exposure.
But before a vaccine or a drug become available, community mitigation will be the most readily or available solution.
Dorsina Drakeford, 3 News.
All right, Dorsina, thank you very much. It truly is fascinating work, and I'm sure you're probably interested to see what your chances are based on where you live. We figured you would be, so we've put a link to this map on our website, WKYC.com. Now, many of us want to get outside, experience some fresh air, just move a little bit. Of course, all of that is very good for us, but there is some new information concerning the metro parks that you need to know about. They are making some changes. Of course, they're encouraging everyone to continue practicing that safe social distancing, staying at least 6 feet away from everyone, but they are now closing several roads in the Brecksville, Rocky River, and South Chagrin reservations. These roads are closing so that they can be turned into walking trails for bikers and for walkers. This way it can basically spread people out. Also, some parking lots and pavilions will have restrictions as well.
We really just ask people to be kind, be respectful. We are doing everything we can, but we need everybody to do their part as well. And their part is to, 1, use the parks, but 2, be socially distanced.
Several outdoor spaces will be limited as well. They've been closed. Those include the Edgewater and Euclid Beach piers. So if you want to go there, you're going to have to wait for them to reopen. Also, the Fort Hill Stairs. And sadly, Squires Castle is now closed. Monica?
All right, thanks, Jay. In Medina County, some folks got some really needed help this morning. Medina Police, Highway Patrol, and the Ohio National Guard came together to pass out 1,200 packages of food. A drive-through was set up at the Medina Fairgrounds. Cars began lining up hours before this event even started. And tomorrow morning, Berea is hosting a food drive starting at 10 a.m. You can drive through, get a bag full of groceries at the Recreation Center on Front Street, or if you don't need food but you want to give back, drivers can also donate, and we put a list of some suggested items on our website, WKYC.com. Now, you know, many teachers, because the kids are home, many teachers are doing all they can to keep their students on track and offer their support. Lindsay Buckingham shares how one kindergarten teacher is going the extra mile to show just how much she cares.
It's not what Monday school days are supposed to be. But Clearview teachers and administrators are making the best of a tough situation.
We are at our second food distribution at Vincent Elementary.
Food, weeks worth, to families who are struggling. Kindergarten teacher Amy Jackson, among those offering words of comfort.
We're doing okay. We've missed your faces though.
And encouragement from a safe distance.
Are you getting your work done? Working every day? Good for you.
She became worried when she didn't see the faces of her young students, many of whom she knew were in need.
None of my kids were here. Not one kindergartner was here. They hugged me and they worked so hard, and to not see those faces every day now just breaks my heart.
Using classroom communication app called Dojo, Jackson reached out, checking in and offering help.
I had a couple parents say, I need food. I said, okay, I'm on it.
So she loaded up her car, hit the road, delivering food and supplies, and through windows, seeing the faces that melt her heart. Last week, Jackson held up her own sign, This week, students surprised her with their own.
I love seeing the faces. It makes it better for the day. And then tomorrow morning when I wake up and I won't see those faces again, it makes it hard. They don't understand why they can't come to school.
So, for now, school comes to them in their front yards, where in a time of physical isolation, Amy Jackson's mission is to stay connected more than ever before. Lindsay Buckingham, 3 News.
Oh, and we want to see your heroes. Please send us a photo and a brief description. All you need to do is text the photo to 216-344-3300. We want to share them on the air with everyone else. Again, text that photo, 344-3300, area code 216. We'll be back after this.
A lot of people need to replace their windows or patio doors.
Officer of Metro Health, Dr. Brooke Watts. We've been quarantined for 11 days since my daughter returned from Thailand. She has been symptom-free, but I've been sick, presumably with coronavirus. I'm at day 9 now and still with intermittent fever. How long does my family have to remain quarantined?
At a minimum of 7 days, and generally at least 72 hours after fevers have resolved. So this is, it's important again, and it's a great question, to continue to quarantine until you're really sure that you're better. And certainly during that time, if you develop worsening symptoms, if your shortness of breath is getting worsening, if you're not able to eat and drink and you're feeling worse, that would be something where you'd want to consult your doctor.
Have the hospitals already been separating the soiled N95 masks in preparation for the Battelle cleaning?
So we are very excited that the technology was approved. Truthfully, most of us see this plan as a backup to the backup to the backup. At this point, we're not to a place where we need to think about recycling or re-sterilizing our N95s, but it's very important that we have access to that technology to do so when we need it.
How many Ohio patients have been given hydrochloroquine or chloroquine, and of those, how many have died and how many have recovered?
Hydrochloroquine or Plaquenil, which is a medication that we use for other autoimmune disease and certain infectious diseases. There's some evidence that this may be of benefit. I think what we're really asking at this point is that nobody take this without medical indication. I think we're all aware there have been several bad outcomes from people who are not infected with COVID-19 who've tried to self-treat. These medications can have some side effects that can be quite dangerous.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.
All right, Dr. Monica, thank you very much. And we want to use this time to remind you that if you have questions about the coronavirus, you can get them to us and we will connect them directly to our experts. Text the questions to us. It's a text number, not a call, 216-344-3300. Well, obviously, one group that is seriously at high risk here are the senior citizens. And the best practice is for them to stay at home. And what that does is it means for many it keeps them from going to the gym for their regular workouts, or in some cases to physical therapists for physical therapy that they are in desperate need of. The good news is you don't need a gym and you really don't even need health equipment in order to stay in shape and keep moving. We talked to a physical therapist from Metro Health who had some great ideas for senior citizens to stay active in their homes.
In the video, it shows people raising their arms up over their head or raising their arms out to their side, hold cans of soup as for a little bit of weight. The exercises that people are doing, you can try to do them for maybe 5 minutes at a time. It doesn't have to be strenuous. It's just to try to stay limber, stay moving. And I would try to do these things every maybe 2 or 3 hours.
These exercises can be anything from, as you saw there, simple arm raises to leg lifts, even just going from a standing position to a sitting position and doing that over and over again. Even though you're not going about your usually daily routine, it's still good if you can to get outside.
We are encouraging people to get outside, even if you just walk up and down your driveway a few times. You can try that several times a day. Just to stay moving, stay limber, get the fresh air. It's important for people to stay moving even though you have to stay home. People might.
Those are all great tips, but a reminder, you just don't have to get up and move if you're not feeling well. If you're doing this and you start to feel a little tired or a little overworked, make sure you stop immediately, especially if you're feeling shortness of breath. Well, there are a lot of changes when it comes to our day-to-day lives. We're really finding out how to live a new normal, but we all still need to go to the grocery store. So coming up, we talk about how you can stay safe when you're out shopping. Some simple things you can do to keep yourself and others safe. 3 News Connect. It's coming right back.
After an accident, the people of Ohio
saying no one under the age of 16 is allowed in the store and no pets allowed either. The new restrictions come as stores are trying to stop the spread of the coronavirus. Customers who look to be 16 or younger will be asked for an ID, and only service animals are allowed. Previously, shoppers could bring their dogs inside. And Kroger is giving an extra $2 an hour to all of its workers in Ohio. Kroger and the United Food and Commercial Workers International Union came to the agreement to add benefit to its workers during this coronavirus outbreak. There are over 30,000 Kroger employees across the state. Its headquarters are in Cincinnati. And a major retailer still under fire for reopening despite the governor's order closing non-essential businesses. The state took action against Hobby Lobby, and Ohio's Attorney General sent the chain a cease and desist, claiming they violated the stay-at-home order. Now, the chain argues that it is essential since it sells educational and make-your-own mask supplies. Here in Ohio, another craft store, Joanne Fabrics, is allowed to stay open because they were granted permission because they sell the supplies needed to make masks, scrubs, and gowns, Jay.
Well, Monica, as we know, it's the start of a new month, and that means many will be getting checks that they'll be using to buy groceries. But we want to make sure when you go to the grocery store, you are as safe as you can possibly be. Will Ewick with some tips for all of us.
They shouldn't panic and get to the store every single day thinking there is not going to be an item.
Carl Ivka, the president of the United Food and Commercial Workers Union, says Rule 1 for grocery shopping during the coronavirus pandemic is keeping your routine shopping day.
And so that would ease that pressure of the growing number of people going through the stores.
An easy way to keeping your distance while still bagging groceries is to go with curbside pickup or delivery. In fact, Giant Eagle is turning their Cuyahoga Falls store into a fulfillment center to offer more people in the Akron and Canton area just that.
That's a big help to curbside, even though, those items will be filled by the workers, but it helps the store traffic.
There are some things that you can do to keep yourself safe if you have to come out to the grocery store, and it starts with wiping down your cart. Things to do when shopping include going alone, wearing a mask and gloves if you have them. If not, you could always use Ryan Brotherton's technique.
So you don't have to touch all the stuff. You slide your hand in the bag.
Of course, practice social distancing while shopping, and most stores now have a plexiglass shield at checkout, but you shouldn't let your guard down when you get home. Take a laundry basket to the car and spray or wipe all of your groceries down with disinfectant before loading up your basket. Throw away all the grocery bags and, of course, wash your hands after you're done. But just a reminder, Ivka says do all of that on your normal day.
The public needs to realize that the stores will be open for business, that they can shop on their normal, regular activity day.
Will Ewick.
That's when they should do it.
3 News.
All right, Will, thank you very much. All great tips. As you know, essential businesses are allowed to remain open, but of course, and we keep saying this, but this is probably the most important thing in stopping this virus, when you're outside the house, please do your best to practice the safe social distancing. And here's some other tips that Ohio's Lieutenant Governor laid out for us yesterday, things we can do to make sure that we are safe and those around us are as well. If you plan on going shopping, I mentioned keeping your distance from all other customers, and part of that means being very patient while you're shopping. If someone is in a spot that you need to go to, just wait until they're done, then move into that area. You should also try to limit the number of shopping trips you take. So be efficient. Make lists and even try to think out a couple of days in advance, maybe weeks in advance, of things that you're going to need so you can minimize your trips. And by doing that, it minimizes the risk. And shop alone if you're able to. Other things you can do. Do not go to the store if you're feeling sick. Please, if you're feeling sick, stay home. You should also be washing your hands before you go and after you go to the store. And also remember to take advantage of things like curbside pickup. I know those options right now are being overwhelmed, as are the delivery options, but if you can use them, please try to. All of this information changing so rapidly. We want to keep you up to date with all of the latest facts on the coronavirus and its impact. To get a direct link to all of our coverage directly to your phone, all you have to do is text the word FACTS to 216-344-3300. That's a text, not a call. 3 News Connect is coming right back.
although I might.
Everywhere face masks during this outbreak, but how effective are the regular surgical ones from stopping the spread? Let's connect the dots.
The director of the CDC warns that 25% of people infected with the new coronavirus may not show symptoms, and that changes the thinking about face masks. Let's connect the dots. Because of the lack of widespread testing, researchers don't know precisely how many people are infected without feeling sick, or if some of them just haven't shown symptoms yet. But right now, they estimate it's about 1 in 4 cases. That high number could explain why COVID-19 is the first virus that is not an influenza virus to spark a global pandemic. That's because people may be spreading the contagious coronavirus without even realizing it. And that changes the thinking on masks. Basic face masks, not the N95 respirator, are designed not to protect you, but to protect others from your germs. So even if you are feeling well but unknowingly carrying COVID-19, a face mask could offer some protection to people around you. A reminder that as we learn more about this coronavirus, it could change how we react to it. Connecting the dots, I'm Janelle Bluta.
And a lot of that information is changing almost daily, Jay. Thanks so much for joining us. We will be back tomorrow with 3 News Connect.
Monica, we'll see you tomorrow at 10. We invite you to join us at 5 o'clock when Betsy Kling and the 3 News team join me for What's New. Take care. See you soon.
Upgrade your home fast and save with 50 Floor. 60% off all